Reaching the most vulnerable groups is an essential part of COVID-19 preparedness and response and improving health equity. The COVID-19 pandemic has exacerbated existing inequities, which are closely linked to the social determinants of health, to conditions in which people grow up, learn, live, work, and age.
Health inequities have always been around, and the COVID-19 pandemic has made these inequities worse. It's been recognized that the health inequities cannot be addressed by the health sector alone. COVID-19 has demonstrated the importance of whole of government and whole of society approaches in healthcare.
The government now is all hands on deck in terms of this vaccination program. And because we are supposed to vaccinate more than 70 million Filipinos, it will be impossible to just use the government's infrastructure to make sure that this 70 million people will be vaccinated. And so this is really where partnership comes in.
WHO has partnered with advocacy groups such as those supporting people experiencing homelessness, like Martha's Kitchen, to reduce barriers to vaccination, like not having identification cards or an address that local government units require for registration. Other barriers can include not having personal protective equipment like masks. In general, they also feel stigmatized when seeking healthcare services. There are approximately 4.5 million homeless people in the Philippines, many of whom are unable to access vaccination.
I think if you live in the streets, you really can't trust anyone. They are always exposed into dangers, into elements. So I think if you want to reach out to them and really educate them and tell them how to deal, for example, in this COVID-19 situation, the problems that we have, then they need someone that they can trust. And if we want to run a campaign like this, like vaccination, where the understanding and trust of the street dwellers are quite low, then they need someone to tell them that, no, it's okay, it's safe, you can go and you can get vaccinated, and you really need it so that you won't get sick.
Trust is the bridge that connects these stakeholders into what we want to achieve. For in this case, for them to have an equal access to vaccines.
What is important is, as WHO works towards promoting community engagement, we utilize the trusted relationship of communities at the ground level with leaders, trusted leaders in the community. This is an opportunity that we need to build on beyond COVID-19.
I'm hoping that in the future, healthcare services would be available and affordable, especially for the people from the streets or the ones that are marginalized and the ones that experience gross inequality.